As of 2023, nearly a tenth of all Americans cannot afford to insure their livelihoods. Among a plethora of issues that plague the United States today, the most recurring one seems to be issues regarding the United States healthcare system. Per Merriam-Webster, healthcare can be defined as the efforts made to maintain or restore aspects of one's health, especially when performed by licensed or trained professionals. Now, it seems discussions about proper healthcare have sort of evolved into ways politicians can gain office and how the rich can continue to grow richer. Lack of proper and affordable healthcare in America has become a systemic problem, and I believe the U.S. can solve this problem via the following three reasons. First, an increase in price transparency. Two, addressing the cost of prescription drugs. And three, providing more accessible primary and preventative care for U.S. citizens. The American people are tired of being nothing more than a dollar value to these companies, and it's imperative to bring reform to this industry. To start, the first step is to maintain transparency between the healthcare industry and the consumer. The horror stories I've heard personally from family and friends about being blindsided by their medical bills have amounted to far too many. The most common example of this outrageous pricing is ambulances, where it can range from $500 to $2,000 with a positive relationship between the cost and the level of healthcare needed. Now, how is total cost calculated, you may ask? Well, hospitals look at a multitude of things such as level of care, insurance coverage, and the mileage traveled to and from the hospital. I feel that if we took the time to override this aspect of healthcare, it would be a great start to improving the system as a whole. There's far too much mistrust between the people and the companies responsible for maintaining a good way of life for these people, and further transparency is a must. To extend upon, the price of prescription drugs has gotten entirely out of hand. Pharmaceutical companies love to take what should be an affordable commodity and make consumers take out a loan in order to pay for it. Another premium example of this would be the cost of insulin. From name brand companies, the cost of a 30-day supply would run you nearly $400. Now, without context, it seems pretty reasonable to pay this much for something from our healthcare system. But when you get into the nitty-gritty, however, it so happens that a 30-day supply should only cost $35 to $50. It's gotten so insane that people have taken initiative and created their own companies or websites to sell affordable pharmaceutical prescription drugs. Without these people taking a stand, many citizens would be left to get their prescriptions secondhand, where they run the increased risk of receiving laced or misdosed medicine. It's not enough for a couple it's not enough for a couple websites to provide for everyone, but it's a must that prescription prices be addressed to take one step closer to better U.S. healthcare. Now, last but not least, we must provide more availability for preventative and primary care. The goal of these practices is to ensure that a person does not contract or be worsened by possible medical conditions. However, a concerning portion of America do not have access to these practices. As previously stated, roughly 10% of Americans are not insured and it cannot afford health care. And preventative or primary health care both fall under the umbrella of what is covered by insurance company. This then creates the tormenting cycle where people don't receive preventative care, leading them to develop worsened health conditions, but then they're unable to afford healthcare and begin racking up hospital bill after hospital bill. And now not only are they bottom of the barrel in society, but they cannot maintain a proper way of life. I believe this step in reform is one of, if not the most important, because it's a start to a more organized healthcare system. If people have access to annual checkups, there will be less people admitted into hospitals. Now, in summation, citizens in the U.S. need to see change in the healthcare industry ASAP, whether it come about by transparency, affordability, or preventative measures. This system is completely unfair and it disproportionately affects majority of Americans. Thank you, and I yield the rest of my time.